Oh. Oh, I wasn't expecting that. Ultimate tree trauma, home invasions gone wrong, and other interdimensional injuries that definitely aren't compatible with life. Today, we're breaking down and reacting to the upside down medical scenes and intense injuries from Stranger Things. Let's dive right in. Oh, I don't want to be a dentist for that patient. Ooh. Normally, a shotgun injury to somebody's head is going to cause probably the head to just be partially destroyed, blown off, typically not compatible with life. You might still be alive enough to be an organ donor, those sorts of things. So you have to have that potential conversation when somebody comes into the emergency department. Falling from a great height, we talked about on the channel before. When you fall from a distance greater than 3 times your own height, increases the suspicion of a serious injury. Hitting tree branches along the way reduces the speed at which you're falling down, but you're still falling pretty high. As it gets pulled on the ground, the other thing that we worry about is road rash, basically. You're getting pulled over top of roots and broken branches and leaves. If your shirt comes off, you can start burning tissue away. We got no tissue around the nose here.
Your nose!
The nasal cartilage is gone. The soft tissue here is gone. So you just have the basic structure of the bone itself. Sometimes burns can look like this, or people who smoke a lot, they have increased aging lines and wrinkles to their face. Ooh. We got this thing going in his mouth. When we have people intubated, usually it's just a tube. One of the bigger tubes is the endotracheal tube, which is what's bringing air in and out of the lungs. And then we'll actually put an oral gastric tube in as well to decompress the stomach.
William, such beautiful things.
Almost looks like he might be having a seizure. He's got eyes rolling back. A lot of times people's eyes when it comes to seizures, they're still looking straight or they're looking a little deviated one way or the other. Ooh, blood to the back of the head. A lot of times we notice people fall down. A lot of in the elderly population, they don't realize if they hit their head or not. So we always need to examine their skull. Sometimes they'll have a laceration, might go through the skin all the way, sometimes not. Depending on your age, there's a likelihood that you're going to get a CT scan if you're having blood from your scalp. Oh, trying to hold your breath underwater while your adrenaline is kicked up. Stress hormones that release in our bodies and cause us to go into our fight or flight scenario, which increases respiratory drive, heart rate, blood pressure. It makes us more alert, makes us more aware. Whew, there you go. The faster your heart beats, the more demand it has for oxygen, requiring you to breathe. So it's really, really hard to hold your breath when you're in those scenarios. You really need to go into a whole other mental space to try to calm that system down. Yep. Woo! Oh, horrible trauma laceration to the mid-chest epigastric area. Looks like there's open skin, maybe organ exposure. You want to put a bulky dressing in this area, stuff it enough to where it's soaking up the blood on the inside, which could cause some compression. Control the bleeding, get the person to the hospital ASAP. How many of you have ever run around your house, slipped on the floor, and wiped out? You do increase the risk of breaking a hip, landing on your wrist, breaking a forearm. These are common injuries, so just be careful. Oh. If this was actually a human getting stabbed with a glass bottle, a lot of lacerations will cause a bunch of bleeding. Usually it won't go through the bone or deeper than that with these type of hits and that type of surface. I feel like it's just gonna stab her. Yep, hitting right flank, mid, so you're getting injuries to your liver, which if you puncture your liver, it's going to bleed a ton. You can have some rib fractures, you can have some diaphragmatic injury, puncture to your lung, as well as puncture to your heart if it goes deep enough. Oof. Blood splattered all over the young lady here with the mouth and eyes open, so you could be getting somebody else's blood into your mucous membranes, which increases the risk of a bloodborne pathogen being transmitted to another individual.
What are you doing?
Get off the train tracks.
This is old age. Just give me a second. No, hey.
Oh, stab wound, puncture wounds, or penetrating trauma. The right lower flank, your appendix, that's where it is. Could actually hit the lower part of your liver, but most likely this is all intestinal or just abdominal wall injury.
First clean, then disinfect, then bandage.
There you go, look at that. When somebody comes to the emergency department, we need to take care of the wound. We irrigate it using pressurized water. Most of the time when you clean out the wound really well, clean the skin around the area and close it up, they typically heal really well without infection.
Stop moving.
Yeah, well, it stings. It stings.
It means it's working.
We get this often when patients are complaining to us that it hurts. Using appropriate gauze here, this is just any type of rolled gauze, so that's pretty good. The only problem with it is it's dry and it can eventually stick to the wound.
Is it sticky?
Oh! Pedestrian versus car, very common reason why people end up at the hospital. You get your legs broken, intracranial bleeding, hemothorax, pneumothorax. Oh, laceration or puncture wound to the right lower chest area, liver, diaphragm, lower lungs. If they're hemodynamically stable, you do your FAST exam, you get x-rays, and you don't find anything abnormal, you have a little bit of time, but you're gonna get a CT scan. When you punch people in the face, it looks cool and you're trying to hurt them, but you're also gonna hurt yourself because the bones of your hands are actually fragile. A lot of people end up fracturing their hands. That's why it's literally called a boxer's fracture. Most of the time, the boxer fracture occurs on your 4th or 5th metacarpal. Oh, come on.
Come on!
Strangulation injury. You're compressing both the blood vessels on each side, so your carotid arteries and your jugular veins. And then you're also compressing your airway. Decreased blood flow to the brain, decreased blood flow in and out to your body. Ooh, get some scissors. She's trying to use her power, but oh, ow. Puncture wound to the humerus area. On the medial aspect, you're worried about the brachial artery. You can bleed out pretty good. It hurts a lot because usually if you hit that vessel, you're also hitting the nerve that's running right next to it. Barotrauma, ear trauma that is happening because of the loud noise without ear protection. You're gonna get tinnitus, you might have decreased hearing as well as disorientation because of the large bangs that are occurring.
I'll be quick.
Getting hit in the face with a gun, mostly metal, some have a little bit of polymer in certain parts of it. Your likelihood having a laceration, ecchymosis, hematoma, as well as the underlying structure is probably going to break, especially if you're getting hit in the maxilla there, which is your sinus. Whoa. Oh, Nelly. If watching all these intense run-ins has your stress levels climbing, you might need a little occasional stress support. That's where Chillax from my company Life Happens comes into play. Designed to help you stay calm when life goes sideways or upside down.
Upside down.
Find Chillax at lifehappens.com or on Amazon. Oh, a flamethrower. Nice. If a flamethrower actually hits you like that, your flesh is going to be melted. Your airway is going to be toast. And it's not going to be compatible with life. The oxygen is gone around you. You're going to be breathing in the flames. I hope you're going to pass out because you shouldn't be in that type of agony. Oh my gosh, so interesting. Feeling the pain of being on fire. People do survive these scenarios. We want to get them sedated ASAP because of the pain. So we'll end up intubating patients quickly. You might as well intubate early because you can get delayed swelling of the airway and then you don't have the ability to actually put an airway in because it's all swollen shut. Oh, wow, wasn't expecting that. That hand is way all the way through that face. It's just funny because we really like to go right through the eyes, maybe because it's like the easier access point. That is definitely not compatible with life and would not show up to the emergency department because they would not be with us. Wow. That is gnarly. Looks like a tree. Look at those whites of the eyes, that clouding, like opal. That means the corneas are quite cloudy for some reason. Usually infection that's causing that or chronic underlying inflammatory changes. If you don't get your tetanus shot, this is what's gonna look like. Your back's gonna be arched like that. You're gonna be pulled backwards and you're gonna be spasming in all weird positions. No, I don't know 100% that's exactly what you're gonna look like, but that's what the textbooks tell us. We haven't seen tetanus in a very long time. It does cause your body to spasm in weird positions and it's quite uncomfortable. So make sure you stay up to date with your tetanus vaccination. Oh, fractures of the arms themselves. We got fracture of the humerus, and these are what we call open fractures, open and displaced. Open meaning that they've broken through the skin, exposed to the outside world, and displaced because they're not aligned anymore. A lot of times they'll snap, go out of the skin, and then come back. But if they're still outside the skin, it is our job as ER doctors to put it back in as quick as possible. We got fracture of the radius and the ulna, stabilize it, splint it in place, and notify the orthopedic surgeon that we have a case that they need to take to the operating room. We need to wash these out so they don't get infected. Snap, snap. Ultimately, what gets them all looks to be like a cervical fracture, separating the body and the head. If you have high cervical injuries in a human, there is the likelihood of a not compatibility with life, usually around C1, C2. Wow. 3, 4, and 5, you do get worried about respiratory issues because of the phrenic nerve that has to do with your diaphragm. People might need to be on a ventilator if they have a mid-cervical spine fracture, but a high cervical spine fracture typically are not compatible with life if they cause a cervical spine injury. Stranger Things, this was intense and pretty disturbing and dark. I know that there are a lot of Stranger Things fans out there, so if you guys enjoyed this, binge watch everything. Binge watch this playlist right here, and do me a favor, let me know what your favorite scenes are or your favorite things about Stranger Things. Leave it in the comments, and please make sure that you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.